Welcome to the Empress Security Insights podcast, your secured beacon of hope. And today I have a very, very special friend of mine and also phenomenal female leader in her industry. Today I'm joined by Gina Malak. Gina, welcome.
Thank you, Maggie. Thank you for having me. I'm really excited to be speaking with you today.
Likewise. And I want to read a little bit about your background just so everyone's familiar here. Gina is a dynamic HL7, FHIR, AI, and workflow automation expert with over 20 years of experience in driving digital transformations and business optimization, specializing in interoperability engineering. She has partnered with healthcare leaders like Stanford Hospital, UC Davis, and Mayo Clinic, resulting in 22 impactful installation go-lives. Gina leads Correlate Health, leveraging AI to enhance patient care and operational efficiency. She's also the founder of Flipping Innovations, a consultancy, biohacking, and marketing company. And Gina has recently been appointed to the Atlanta Mayor LGBTQ Advisory Board, serving health equity. And congratulations.
Oh, yeah, that was a lot to unpack. Yeah, thank you.
Well, yeah, we'll just kind of dive right in. We've worked together on projects, and everything just has really been so organic. And getting to know you more, that's how you are in your approach with life. It's real, it's authentic, and it's refreshing. And I love to partner with people like that. And so, especially as a female, this episode is going to be posted on Juneteenth here in the United States. And on top of that, it's June, which is Pride Month. And we've got a lot of great things going on, especially with women in technology and really helping us all bring these messages together. And you're a triple threat, and I love it. And it's so inspiring. And so I want to kind of dive into entrepreneurship, how you kind of got started. How would you, look at some of your earlier struggles in your career versus some of the later on challenges that since you've been in more of a leadership role? How has that changed for you?
Wow, I first got started in my career. I'm telling my age. Back in the 90s, actually, I was going to college and I was studying to become a doctor out at San Francisco State University. I was pre-med. And like every other student, I needed a job, right, to sustain and, to go to school and help supplement some of those student aids. And I started working for Wells Fargo's as just a part-time job. And Silicon Valley was on the rise with the dot-coms, and I was introduced to technology. And as I learned more about technology, I was just more intrigued. And I went back to school and changed my major and changed it into technology. And I wanted to learn everything about technology. I mean, from hardware to software, and early in my career, just navigating, just observing and learning. I focus on understanding the dynamics of, the organizations and, and identifying, key influencers and building strong relationships with mentors and colleagues. Everybody that I knew a certain skill set, I sat right under them because I wanted to learn. I wanted to learn this business. And that transitioned into a more formal role for me. Making strategic decision making, got into project management, from then now a solution architect, into starting my own consulting business. So I started consulting. I moved into healthcare in 2004 in IT, and helping hospitals moving into electronic medical records. It went from paper to electronic medical records. So I was at the beginning of that, and it stuck with me. And I've been in healthcare IT for over 20 years now. And so that helped leverage and push me to start my consulting business, consulting with hospitals and medical universities of implementing their electronic medical records, their web services, applications. And then in 2019, I launched my own digital health company. And, and with my partner, Sharon, And that kind of helped me to navigate, the power structure early on from my career to becoming more of a former leader in my industry.
That's awesome. I love that journey. And I really love how you acknowledged what you went to school for and then the transition to IT. So many
Yeah.
people can familiarize and resonate with that. I myself, I went to college for occupational therapy. And now I'm in cybersecurity and tech portfolio advisement. I never would have guessed this is where I would have landed. But, uh,
Yeah.
it's interesting when you're talking about the healthcare industry. Um, I originally started recruiting doctors to do pre-discharge exams for soldiers coming back from Iraq and Afghanistan as a part of the VA contract with Lockheed Martin, Department of Defense. And oddly enough, my grandfather was a doctor in women's health care. And I
Wow.
don't know how I forgot about this. I've just been so focused on work recently. And then we started partnering, and I started thinking, I'm like, wait a minute, my grandpa, God love him, he passed away when I was 10, and I'm like, he would be so proud of me, and you in particular, because he would have probably sat here and picked your brain, and I'm like, I got to get you on here. Let's talk about this because it needs talked about. And especially,
Yeah.
I've seen your projects, I've seen your technical abilities, I've seen how passionate you are, and you don't just get that everywhere. Sometimes people, they don't have the passion anymore, they're burnt out. You are not, and you're a powerhouse across the board, and you're a lot of fun to work with. And
Yeah.
so, hearing your journey and your story, it's inspiring. And I love that now you're in this thought leadership position and you're inspiring the next generations. And so that's part of the reason I asked that question. And I want to kind of go back to your intro. This was something that I really admired about you. And so, if you would tell us a little bit about your recent appointee role with the advisory board in Atlanta with LGBTQ.
Wow. That was a tremendous honor and responsibility I take seriously. I was appointed this actually last month. We had to keep it on a hush until the actual official, press release went out. That it is an honor. I mean, I moved here from California in 2006 to Atlanta, Georgia, and I've always been everything Atlanta. I'm considered a Georgia peach now. I've been here so long, but to take the responsibility and my passion in healthcare, especially in health equity, is really validating and invigorating, to be recognized for my work in health equity and advocacy. The board is focused on addressing health disparities within the LGBT community here in Atlanta. We aim to develop and implement policies and programs that promote inclusivity, provide better access to healthcare, and to really ensure that specific health needs of the LGBT community individuals are met and being addressed. This involves with collaborating with local hospitals, healthcare organizations, conducting community outreach, and advising on best practices for equity in healthcare delivery. So we're just getting started. We have a team we have the health equity team. It's about 5 of us on this team. We're starting to start having meetings and start to get involved with the community and coming up with a plan on outreach and education as well. So I'm really honored to be a part of it. I'm honored that Correlate Health is also being a part of it, me as the CEO of the company, so that's being recognized. And I'm just excited, to see where we're going and how we can help the community.
Right. Would you have guessed even 30 years ago you'd be in this position?
I, my grandmother always told me I was going to be some type of superstar, and I don't know, I was just like, okay, Granny, bet, you know, I guess I'm very spiritual. I'm also a minister at the Vision Cathedral of Atlanta, and I'm a visionary. So I always see myself in a leadership position, but I'm also a philanthropist. How can I help? I always like to help people. And this is a way to take my subject matter expertise, my passion, and my philanthropy endeavors and taking it to the forefront. And so I've always seen myself as a philanthropist. And so if that means visualizing myself in this position, I am honored, but I did definitely see myself in a position of where I can be of help, and then also have more community awareness, and being involved within my community as well.
Absolutely. And as a woman of faith myself, very spiritual, not a mistake, not on accident by any means. And it's awesome. And I love that. I love that story because servant leadership, it sounds so, I don't want to say this and be looked at the wrong way, but it can be marketed very surface level, or covered in a way that just sounds agenda seeking. You're the real deal. And it's an energy, it's a frequency. And that was something that yes, absolutely. And that was something that I really like to focus on as we all build out businesses together. And I mean zero discrimination when I say that with any leader, because we need more of that. We need more of that connection. And yeah. I see so many disconnections in business, right? And investment. Mm-hmm. And so kudos to you for being so brave and courageous and just being yourself and just coming out with that raw passion of life and leadership, because so many of us sometimes get lost along the way, and you truly are inspiring so many people. I'm sure your family is just ecstatic for you, and I hope that you're all able to celebrate with everything that you have going on. I want to talk a little bit about, you kind of covered why you started Correlate Health. I know what your priority is at this time, just because of some of the things we've been working on together, but yes. What's top priority for Correlate Health, or what's coming up in the next 6 months?
What's coming up with the next 6 months, we have our Correlate Health. We are a digital health company, as you know, but for the audience, what we are doing, we're innovators, and interoperability and clinical trials and clinical study has been really a passion for us. And so what is Correlate Health doing now is that we are a AI EHR, patient data clinical trial matching solution, and it is addressing the issue of patient recruitment in clinical trials, which is a issue. There is a lot of mismatches, not exact matches, not enough diversity, inclusion, especially in women's health, LGBTQ, diversity. So what we're doing is addressing the significant process of matching patients by integrating with the EHRs, using AI to get an exact match on patients, so that once there is a match with clinical trials criteria, that message is sent directly to the patient's health wallets. And that's when it has more patient engagement, and that's lacking too, more patient engagement, not training, I should say education, onboarding process. And so what it does is helping to retain and create more of a match. And then also the recruitment is increasing the recruitment process about 20%. So that's what we're doing, Correlate Health. My top priority right now is scaling our business, bringing on more providers, research institutions, technology companies, and streamlining, our onboarding, but also scaling our process. And most of all, we are in a process of seed. We're in our seed fundraising. This is our second raise. We did a crowdfunding. We did an angels investment round, and then we did also a crowdfunding a couple of years ago. And so now we're at the seed raise, and we're looking to raise about $5 million. And that's going to support our growth, further development with our AI solution. And our goal is to make our platform a standard tool in clinical trial recruitment and patient engagement. So yeah, that's where we are. And you, Maggie, being a part of the team as well, our faithful advisor. And then we have, I'm a co-founder with Sharon Collier. And then we just brought on as well a CFO, Gary. He's a rock star. Love him. And we just have a host of advisors as well, from all the way from Dubai and the UK and across, United States, advisors from the financial industry, from the clinical industry, and also business. So yeah, that's where we are. That's a top priority for Correlate Health at this time.
We're going global and we need some cash.
Yes, we
Yes,
need money.
absolutely.
Accredited investors, please contact us.
Yes, yes. I want to talk about something here, and I want to help people connect this. My mother passed away from leukemia right as the pandemic kicked off in spring 2020. It was already a nightmare to go through that for 15 months with her. And because of the restrictions when she passed away, we had things like you could only have 10 people at the funeral home. Access to hospice was almost unheard of. It's already hard enough to go through that as a family, and then you have all of that happening. I didn't get to see her for weeks towards the end. It was horrible, right? The reason I bring this up is because everyone can relate to losing a loved one. Yeah. And unfortunately, none of us are getting out of here alive, and that's why living in the now is a huge, huge thing. But had we had resources like Correlate Health, when she found out she had leukemia, she may have still been here. Yeah. She may have had longer, more time to spend with her grandbabies. And I don't know a single person that couldn't resonate with that and with this technology, because it truly can help every single human life across the world. And, people invest in people, and obviously you got to have the business operations and the, your decks and everything that goes along with the investment. But part of the reason I wanted to really highlight you is because I believe in you. I've seen you from the ground to now, and I truly understand that you also personally know what the human connection is. And I really hope that this message gets shared appropriately with everybody across our networks. I hope it goes viral. I hope it gets shared with Maria Shriver. I hope it gets shared with all of these amazing resources. Mayo Clinic, I know that you're working with Mayo Clinic. I hope it gets shared with everybody, because we're truly trying to help save lives here. And that's at the end of the day what this is about. So I just want to make sure that we talk about the importance of your product, and it was fueled by passion and love, and not a better duo than you and Sharon than to kick this off and bring this to the world to help.
Thank you. And that is the foundation of the premise of our company, is to help save lives. And we hear so many stories, about people, loved ones, that if they had known about a clinical trial that could help their loved one to save their life, just so that they could be here longer, it's just unfortunate. And that's one of the things that is the driving point about Correlate Health. How many lives that we can help save by bringing in interoperability. The FDA has thousands of clinical trials available, but finding a match and based on someone's health profile by just doing a simple query and then sending out a notification to that patient and say, hey, we found a clinical trial that matches your health profile. That is tremendous. And also, we have a patent provisional on that as well. But the thing is that the bottom line is how many lives that we can help save, and then we can help, and then also just sustainability of human life to be here as long as we can here on Earth.
Absolutely. Yeah. Awesome. Well, thank you so much for your time. It's a pleasure. If anyone wants to get in touch with you, donate to any of your boards, or help back your philanthropy, what's the best way to get in touch with you, Gina?
Let's see. You can get in touch with me at G Malak, GMALAK, at Correlate Health. Correlate Health is CORRELATE health.com. and you can get it
Awesome.
right there. And thank you so much, Maggie. I really appreciate you and this platform. I'm such a big fan of you too. I just love watching your
Thank you.
blogs, and it's to me it's just so empowering. So kudos to you as well as a female on doing this platform, and the level of people that you bring in is so inspiring. So keep it up too. That's
Thank
one.
you.
That's why you are one of my besties as well, and I really appreciate you as well. So thank you.
I
'Cause
appreciate it. Thank you.
yeah,
I will say this. Uh, I work with the best, and I'm not just talking about their business. I'm talking about their hearts and just who they are as people. And so, if you go that route with your career within your life and your friends, your family, and all that, you won't go wrong. So, thank you so much for your kind
absolutely.
words. Always, if anyone would like to get in touch with me, you can find me over on LinkedIn. Shoot me a DM. I'd love to connect with you there. And in the meantime, thank you for tuning in. Have a great day.